My father had advanced chronic pulmonary disease, and I always believed that if he could have been more physically active and fit, that he may have been able to function better. So I was in my early years of college at the University of North Carolina, and he died. So I selected physical therapy primarily because of family illness. I grew up in rural North Carolina. My dad and my family were tobacco farmers, and my dream was to go to the University of North Carolina. Then I fell madly in love and dropped out of college. And it was during the Vietnam War, and my husband was stationed in Brooklyn Naval Shipyard. And it didn't take me but 1 year out of college to realize that I really needed to return to my passion of going to school and becoming a physical therapist. So I started looking around New York to see where are there programs in physical therapy, and I selected Columbia. My Columbia education was critical to my career. The experience with the faculty always defines your career. The other thing that was so important about the Columbia education is very early on during our education, we took courses with some of the medical students. I became very interested in complex patients and motor recovery. And after I left Columbia, I continued the trajectory of being interested in stroke and stroke recovery, and worked at the Institute for Rehab Medicine on the stroke unit. As I worked with stroke patients, I realized that there's tremendous variability in recovery. After I practiced for a number of years and actually was on the PT faculty at Duke University, I went back to get a PhD in epidemiology at the University of North Carolina. As you look at the trajectory of my career, you think, well, how did Pam Duncan move from a clinician to a well-funded researcher to also well-known in policy? And I think it stems from my risk-taking behavior and my personality, always seeking another level of influence for healthcare. I am an expert in methodology for clinical trials. With a career of receiving a lot of funds, over $50 million in my career, I know how to write grants, and I know how to design trials, and I also know how to bring science to frontline clinical practice. So currently I'm mentoring collectively about 5 physicians. I work with Dr. Isham Haq, who is a Columbia graduate and who is a movement disorders physician. And Isham is looking for a career development award from NIH, so I mentor him in preparing those. We are in a major transformative period in healthcare, in which we really do have to redesign healthcare. We can no longer look to physicians to be the primary or sole providers of healthcare and set all the directions. So as we prepare new students in physical therapy or any other discipline, we have to be educated at a much higher level. The other thing I think I've learned over my career is ultimately, it's the patient. It's not the therapist, it's not the doctor, it's the patient. It's the patient. And how do we get patients and support them to embrace their own health and wellness? It's the key. What drove me when I walked out of the Columbia program drives me today. We all have to have a why. A why. Why do we get up in the morning? Why do we do what we do? I have never not felt that I made a difference in a patient's life. And you're looking at patients who are very vulnerable times in their life, and we can provide hope and the hope of recovery and a good quality of life. And what could be more inspiring, and what could be a better why? I'm Pam Duncan, and I'm a Columbia physical therapist.